Hello, I am your host, Dr. Jack Braha. Here on the show, we bring you local healthcare providers to discuss the topics that matter most to you and your health. Our guests are active in the community, providing healthcare to our fellow Brooklyn residents. We are happy today to welcome Dr. Sandra Scott, Chair of Emergency Medicine at One Brooklyn Health. Welcome to the show, Dr. Scott.
Thank you for having me.
So you are the Chair of Emergency Medicine, a big area of service in the hospital system, One Brooklyn Health. And we're happy to have you here today because we could talk about almost anything when it comes to emergency medicine. But obviously we are here during the time of a pandemic, so we'll touch on COVID and how One Brooklyn Health is dealing with it, especially in the ER. But before we get to the meat and potatoes of the show, why don't we help our viewers learn a little bit about you. Tell us where you're from and how did you end up here in Brooklyn and at One Brooklyn Health?
Sure. So I'm originally from New Orleans, Louisiana, actually. And I went to medical school in Texas at Baylor College of Medicine. And then during my time in medical school, the first, one of the very early specialties I was attracted to was emergency medicine. And I was fortunate enough to be able to start an emergency medicine residency in Boston, at Boston University. And then when I finished in Boston, I had a strong desire to live in New York City. And my plan was to live in New York City for just a couple of years and then head to the West Coast, but I fell in love with New York City.
We trapped you here.
Yes, indeed. Yes, indeed.
I'm not from New York City either, but I trained in New York City. And once you're here, it's kind of hard to leave. It's a combination of things. For me, it's the food.
I think for me, it's not unlike the specialty of emergency medicine. Like, if you choose, every day can be a different day, and there's a little bit of unpredictability about the days. Yeah. And so I really enjoy that. You know, if you wake up and you're feeling like you're in a classical mood, you can be classical for that day. And if you feel like you're in an R&B mood, you can be R&B. And I think that variety and spice of life is what attracted me.
Yeah, one of the greatest things I found about New York when I first moved to New York City was any night of the week I can go to a concert. And growing up in New Jersey, we had some music, but you know, there was one show once a month at a big theater. And the arts in New York are amazing, but the medicine in New York is also rather incredible.
Exactly. And that was one of the things that also attracted me to New York City. My first job was at actually Kings County, which is part of the Health and Hospitals Corporation. And so I really started my career with urban emergency medicine and became very attracted to it, and eventually that's what landed me here at One Brooklyn Health.
But you've been in some major cities during your career and at some major institutions, especially with emergency medicine. So you've had great exposure across this country to the urban centers with emergency medicine. How does Brooklyn compare to Texas or to Boston or New Jersey, other places where you've been?
So I think, the variety of the patient population, right? And so in all of the places where I lived, there was we call it a high acuity, but basically the patients were very sick that presented to the ER, and the patients didn't necessarily have access to primary care. And so by the time they present themselves to the emergency department, there was a wide variety of illnesses, and they were very, very sick. That is true too of the emergency departments in One Brooklyn Health. I think it's just the charmingness of the variety of ethnicities that we treat that really makes it a warm and wonderful place to be. And I must say that it's one of the most warm institutions. So people really work together. And you may know that One Brooklyn Health is a very new network. We're a new system. And so it's really been exciting to be a part of creating a new health system.
Yeah, I think to the viewers out there, they're starting to hear a lot more about One Brooklyn Health. It's a conglomerate of hospitals and institutions, and you're in charge of emergency medicine throughout the system. So it's not just one hospital or one ER. You're taking care of multiple institutions. Mm-hmm. We're here today at Brookdale University Hospital, a major trauma center and a busy hospital. And unfortunately, in these areas, we've been seeing a lot of our patients affected by COVID this year. So we must touch on that today because of the times. We're wearing our masks today, our PPE. Tell us about how COVID has really affected you here at One Brooklyn Health and at your ERs.
So, we were hit very hard in the spring, like many hospitals in the Brooklyn, Queens area of New York City. And by hit very hard, I mean we had a large burden of cases. And so we had to really work collectively amongst the 3 emergency departments and the 3 hospitals to share ideas and sometimes even share resources to make sure that we had the equipment that we needed to take care of the high volume of patients, and particularly COVID patients that were very ill. And so in preparation for this, the second wave that we're in, unfortunately, we were capitalizing on that experience in the spring, where we learned how to very quickly assess the equipment that was available across the 3 facilities. And if one facility is in need of a specific piece of equipment, staff, resource, then we move those resources around to meet the demands of
The
the
benefits
patients.
of being in a system. You
That's
had
exactly
extra
right.
resource. Were
That's
you
right, that's
exchanging
right.
personnel with doctors and nurses, all hands on deck, basically?
All
right?
hands on deck. And that's true across the country now. I mean, one of the things that is painful for me is we were when I say we, I mean New York City was really in a horrible place in the spring of 2020, right? And so it's really painful to know that other cities and states are experiencing.
It was hard to watch.
It was
I agree with you.
very difficult
Yeah.
to watch.
Because
Very difficult.
we had done really well in the summer. The numbers were dramatically down. At our hospital, we were only down to a couple of COVID patients where we had hundreds. And you see the video from the South, and it's like watching the experience all over, although someone else is going through it. And it was very difficult to watch. I agree with you.
Yes, and I think also, one would think that the healthcare system in America is one of the best, right? And I think it's difficult for physicians to grapple with that, right? Because we
Yeah.
think of ourselves as having all of these resources.
We could do
and
anything.
We
sort
can.
of.
That's exactly right.
But this was almost battlefield medicine at some point for us here in New York.
That's right.
And,
And now across the country.
Yeah, and now unfortunately we're seeing more deaths a day than we've ever seen in this country. And but we are better equipped, at least here in New York. I can speak for my hospital where I am and from your system. We're much better equipped and prepared than the spring.
Yes, and I think another advantage to today compared to a year ago is our state and city government and governmental agencies are making sure that not only do we work together within systems, but across different systems, right? And so we have, I have daily conversations with other supporting systems. So if we're not able to provide the resources for our patients from within our system, there are now much more fluid communication between our systems.
We
and
worked a
other
lot in
systems.
isolation before, and that was okay for the time. But now with the stressed resources across systems, across hospitals, doctors, we're all talking to each other. System leaders like you are probably on the phone and on conference calls a lot more than you used to be with other systems.
That's right. And I think that's a good thing because I believe that the way that we're going to get out of this pandemic is by working together.
So,
Right.
I agree. And part of that partnership between hospitals and government, there's also this big partnership between us and the community.
That's right.
Right. And so for a couple of minutes, let's talk about COVID-19 for our viewers because it's not going away. We might be getting a better handle on it, but it's out there and it's prevalent. So let's touch first on the patients that come to the ER, right? When you see a patient in the ER, what are some of the factors that the ER doctors right now are using to say, this is a patient that needs to stay here in a hospital or can maybe go home and get through this on their own? So for our viewers, I want to spend a couple of minutes practically educating them on what we look for as physicians in the ER to say, this guy is staying in the hospital, maybe this one could be seen in urgent or in primary care follow-up.
Right, so I think for the person at home or the person that texts me and says my family member has COVID, which I'm sure you receive a lot of those calls as well, I think the oxygen level, right, we call it the oxygen saturation.
The pulse oximetry.
The pulse oximetry, right? So another beautiful thing about January 2021 versus January 2020 is that you can now actually go to the drugstore or you can get on your favorite online purchasing app.
Right.
And you can actually purchase a pulse oximetry for your home that's battery operated.
Right.
That's
No one ever talked about this before COVID. Now when people are ordering them,
yes. And so for me, that's the first thing I ask, or do you
Right.
have a pulse oximetry at home? And actually, some people say yes. And if they say no, they are able to get one within 24 hours, right? And so I think whether you're at home or in a emergency department setting, that's one of the key measures that's simple enough to understand that we look
That's
for, right?
one of the magic numbers, is this percentage of oxygen.
That's exactly
So that's
right.
a good point.
That's
right.
exactly right? And so if I'm speaking to someone at home who's not in medicine, I'll give them a magic number like 95, right? And I'll say, as long as you're above 95, then you can text me and tell me how good you're feeling. If you start to move towards 95 or below 95, then we need to have a serious conversation about how you're feeling and what the next step is. So just like at home, we have a few key numbers and lab values, and really I think how the patient feels and whether they're at high risk, right? So now I'm sure the viewers see on television that various risk groups are being approved to receive the vaccine. So we have a similar thinking when we think about who should go home. So if you're
the same people who are eligible for the vaccine are kind of the same people we're worried about when they get
That's what I'm getting at. That's exactly right. So it's a similar, if you have a lot of health conditions and you're elderly, then you're at a different risk than a healthy 20-year-old that
more likely to come on in.
There you go. So we look at how your clinical condition, your risk factors, and then how is your breathing.
Yeah, you guys are on the front line. The ER doctors, I'm a gastroenterologist, used to want to be an ER doctor, so I know what it's like to have been there. And you guys are the front line. You make the major decision. Does this patient here have to stay in the hospital or not? It's a hard decision sometimes to say, well, you can go home. You always take that little bit of a risk of you might end up coming back here. I have found that some patients are really surprised that when they go to the ER and they're diagnosed with COVID, that the doctor says, well, you can go home now, and because it's not a disease where everyone needs to be admitted. But there are risk factors, like we talk about the elderly, diabetes, blood pressure, where the prognosis could be significantly worse.
That's right.
How many patients a day were you seeing across the system when we were at the peak, and what are you seeing now? Is it less per day?
So I'm sure you know that emergency departments across the city, and I think this is also true across the country, in general, the volume of patients is down, right? So most of the emergency departments in the city are not seeing the same number of patients that we saw per day pre the surge in the spring.
Right.
However, the patients that we see tend to be a little bit sicker, and I know I can speak for Brookdale in particular. We're admitting more patients per day, even though our total volume is less than we did pre-COVID.
So the proportion, the number of patients who are coming in is less, but they're sicker than they've ever been, sort of percentage-wise.
That's exactly right. That's
right.
So the numbers are a little bit deceiving. Like the physicians and the nurses and the rest of the staff who provide care for patients in the emergency setting may not be seeing the same volume, right? But we're working just as hard because the patients are a lot sicker.
Yeah. So where do you think the other patients are going? Are they better educated and staying home and riding it out? Is urgent care picking up the tail end of this?
So I actually think that there is still a fear of seeking care, especially in an emergency department setting. So I do believe that some patients are just not returning.
I see that. I agree with you. Even in gastroenterology, there'll be a patient who comes to my office where I feel they're very sick. And in 2019 or very early 2020, I would just send this patient to the ER and they would agree with me. Whereas now, some of them resist or they push back quite a bit. I lose sleep at night worrying about that patient refusing to go to the ER, but you're right.
Yeah.
People are afraid. They shouldn't be afraid, though, if there is a true emergency. We take great precautions to keep people safe.
Well, I mean, I can understand, but let's be fair, right? I mean, I can understand because the emergency department, it's not a appointment kind of...
It's a tough environment.
Right, so if 5 people show up in an hour, we treat 5 people in an hour, versus if you have an office setting, you can spread those people out over the hour. Now, what we did do is we opened a different care area of the emergency department, which we call the Express ED. And the whole concept is that it's a separate area that's still part of the emergency department, where we can only take care of 4 patients at a time. And patients can actually call ahead and then we can actually save a time slot
So
for
that's
them.
a nice little
So
area.
yeah, so we were trying to do that just because of what you just said, to give people an option. So if you have a patient that you want to send into the ER
Right.
and they don't require, emergent resuscitation, then that they might qualify for that type of care. And that way we can kind of intake them and not have them actually see the larger emergency department proper. And that's actually been a win-win for certain cases.
It sounds like a nice little niche or area of the ER that can accommodate people maybe a bit more comfortably and
It's not.
without the
It's not
fear
as.
maybe as
Yeah,
much.
it's not as daunting as being
Yeah.
in an emergency department where you might see someone come in cardiac arrest, and you might actually see very sick people, and that can cause a lot of anxiety for some
Well,
people.
that's our ER doctors. They're able to handle anything at any time, and they don't know what's coming through the door. And likewise for patients who come in, they'll never know how long they're going to wait and how busy of a day it might be. But we've wondered also in gastroenterology, where have some of the bleeds gone? Where have the cancers gone, or the gallstone patients? And we hope they're not sitting at home putting things off. We want patients to come into their doctors and into their providers, and if they need to be in the ER, to come and know that they're going to get the right care. And, we don't want them to be too afraid. Let's shift a little bit to prevention, because this is a different conversation than I had with other doctors on the show months ago. We have vaccines now.
That's right.
And
And
you did it?
I did it. I did it. In fact,
Me
I
too.
got my booster, my second injection on Tuesday.
This past Tuesday?
This
or?
past Tuesday.
So let's talk
So-
about it. I had mine last Tuesday.
Oh, very good. All right. All right.
So I'll tell you mine, my experience. Tell me about yours. I got the first shot, nothing. First shot, I felt fine. Little soreness in the arm. How about you?
Same thing. Exact
Okay.
same thing.
Second shot, I definitely felt it from the minute they gave me the shot. I had a sore arm, and the ER calls to wake me up in the middle of the night. And I went to reach for the phone with my left arm. I could not move my arm without screaming. It hurt. So I definitely felt it on the second shot more. Muscle aches in the morning. I had some joint aches. I took 2 Tylenol, drank a whole bunch of water, and had a coffee. And by 24 hours after the shot, I was back to normal.
That's right. That's
Tell me about your experience, because I want our viewers to really hear it from us who went through it already, because they're next in line.
That's right. And I think first of all, we should talk about emotionally, how did it feel?
Yeah. I was
Right, so-
anxious. I was
Yeah.
a little scared.
Yeah, so I think, the first shot requires a bit of courage.
Yes.
Right? Because, there's some elements of unknown there. And I
Yeah.
think we should be honest that even as advanced healthcare providers,
We don't know.
there's
Yeah.
a tiny bit of anxiety. However, I had a lot more anxiety about not being a part of the change we want to see in this pandemic,
Absolutely.
right? And so I think that we have an obligation to be on the front line of the vaccine
Yes.
movement, right?
If I'm going to recommend something for my patient, it's going to be the same thing I would do for myself. I don't treat patients differently than what I would do for me or my family, and they know that. I tell them. And so, how am I to recommend a vaccine to somebody and I would refuse? No, of course not.
That's right. That's right. So the first vaccine, after the first vaccine, I felt very proud, and I felt like I was a part of something innovative
Historic.
and exciting and
Yeah.
historic. Yes, yes. And then I had the sore arm, and that went away. For me, it was after about 48 hours.
Yeah.
And then I started approaching the 21-day mark when it was time to receive the second vaccine.
Yeah.
And I had heard that many people were fine after the first injection, but after the second injection, the 24 hours of flu-like symptoms. And some people describe having chills and
Yeah, I heard that
being
from
in
a
bed and-
number of my colleagues.
yeah,
yeah.
and then I have colleagues who say they were fine, that they bounced up and they were just
Right.
fine. So I was mentally prepared, and I did experience fatigue,
Yeah.
right? So maybe like around 6 hours after the injection. The soreness is to be anticipated. I was fine with
Yeah.
that, but I felt fatigue, and then. I too took some Tylenol, and I'll be honest, I took some Advil too. And then I was okay. I was tired, a little achy, and
Right.
I agree with you that at the 24-hour mark I was back to myself.
Yeah.
And actually now I feel. I know we're not invincible, but I do feel that it feels really, really, really good to have that added protection. I still am sanitizing my hands.
We're following the same
Absolutely.
protocols because
Absolutely.
nothing is 100%, and we still want to protect our patients also from other things that could be out there. But I felt good like you did. I was proud that I did it. I was definitely nervous before the second shot, though. I sat there, and I'm not so good with needles. I can inject anybody with a needle, I can cut anybody open with a scalpel, but you bring it towards me and I start to get nervous. But second shot, I agree. There was a little bit of fear there, and you knew you'd feel it.
But I can tell you, we've been obviously vaccinating our employees, and we've relatively recently, with the expansion of the criteria, we've actually been vaccinating members of the community.
Absolutely.
And it's just beautiful to see the community coming in to be vaccinated, right? And so in spite of all of the hesitation and all of the kind of misinformation on social media, I was told yesterday, I believe, a 100-year-old came in to get vaccinated, which I just think is a beautiful.
A colleague of mine brought they're physicians in the family, brought their grandma in, who was also, I've taken care of her myself, in her high 90s, I believe, and with her walker, she came in, she got the shot, and it almost brought tears to my eyes because it was just such a proud moment that, hey, we're going to protect the highest risk.
That's right.
At our hospital, we had people write notes. Why did we get the shot? And you know, for most of the people we spoke to, the physicians at least, it was basically, I want to be able to keep working and protect my patients. And if I get sick, I go down and I'm out for 2 weeks. You can't help people. And there was a lot of selflessness in it that you saw from the nurses and the techs. And it really was, like you said, it was really great to see. It was emotional. I was on the second day of them giving it. And, you know, I put it on my Instagram. I wanted everyone to know so that they would go out there with confidence.
Absolutely. And I think you just brought to mind when I went to vote in the last presidential election, I saw, you know, the 90-year-old coming into the voting center, and they got to skip the line. And we were doing something similar, to be honest, today.
Yeah.
You know, we were kind of, my staff were kind of picking people out of the line, and
we don't want grandma all the way at the back.
No, yeah, we were bringing grandma to the
Yes.
front of the line, and I had a similar. I think it's really beautiful in this country that we're celebrating and,
Yes.
and working to protect our elders.
This is all for the good of everyone else. Wearing the mask, in large part, was to protect someone else, not to protect you. And it's a nice time in this country to see people coming together now with the vaccine. We're all desperate to get it, and hopefully we'll have enough shots soon enough. And I hope your ER is not as busy as it was this spring as it was last spring, and part of that is getting the vaccine out there.
That's right.
And so as physicians, I know you got it and I got it and I'm comfortable. I know that there was not the long-term data that people were after, but we have to use the best knowledge that we have so far. And most of the doctor friends I have, I would say 8 out of 10 so far, 80% of the doctors I know have gotten the vaccine.
Yes, so there's been a very large acceptance on the part of physicians of the vaccine. I think people who maybe don't understand the science, which it is a little bit kind of difficult to understand the messenger RNA and the coding and everything. So I mean, one of the things I think people think, at least of the 2 vaccines that are available in the US now, that there's COVID virus in the vaccine itself.
Right.
And so when I explain to people that there's no virus in the vaccine, that this is really a state-of-the-art vaccine that uses a code that tricks your body into making spike-like proteins, then people, I think, start to like,
Yeah, you
when
make a good point.
Yeah,
I was drawing pictures for some colleagues, some of the nurses I work with who had some questions about it, and some patients, and I explained, it's incredible technology. I mean, we're on the forefront of something that, because of COVID, this may become a tremendous part of our future in biotechnology. And so, I think when you explain to people sort of get a better understanding and acceptance of it.
Yes.
So we talked a bit about COVID and more importantly, COVID vaccination. We have a few minutes left. And as chair of emergency medicine for the system, let's talk about the future of One Brooklyn Health, and maybe, you know, what do you see as the future of emergency medicine in Brooklyn and in One Brooklyn Health for our viewers who are watching today?
Yes. So we have 3 emergency departments. One is at Kingsbrook, and the plan is that in the future that will actually be a freestanding emergency department, or I really should say a standalone emergency department, right? Mm-hmm. And so the acute care beds will be at Brookdale and at Interfaith. And so there are some advantages to a standalone emergency department. In general, emergency departments compete with the rest of the hospital for things like CAT scans, for things like consultants, and for other resources, the lab resources. So when you have a standalone emergency department, all of those resources are just for the emergency department. So they typically have a much faster
Getting patients through quicker.
right, because the CAT scan belongs to the emergency department. The
Very
lab
nice.
belongs to the emergency department. So we're actually in the process of planning for that emergency department to be a standalone emergency department. And then you mentioned Brookdale. So Brookdale is a level 2 American College of Surgeons certified trauma center. We have a cath lab, we have a stroke service, and so Brookdale serves as kind of the tertiary emergency department for the system.
The mothership, so to speak, of you have every resource that you might need in the ER.
Correct. So we have more consulting services available at this campus. And then we have the Interfaith Medical Center Emergency Department, which is also a community-based emergency department. And what's really special about the emergency department at Interfaith is that we have some very robust psychiatric services that are available at that particular institution, in addition to acute care, regular hospital beds. So if someone is looking for like a drug rehab program or some specialized psychiatric services, those services are actually available in that institution. So I think it's really interesting that we have 3 very different emergency departments. And we're working to bring the different physician groups together so that one doctor could work at any of the 3 emergency departments, and really just bringing all 3 together as one big fluid family.
So you've got a full plate in front of you to manage, and I don't envy. I think you've got tremendous work to do in supporting the One Brooklyn Health System, and I wish you great luck. Sounds like between the 3 ERs you will be very busy, and you have the resources to offer our citizens here in Brooklyn. And I want to thank you for coming onto the show and for educating our viewers about COVID, about emergency medicine, and more importantly, the future of One Brooklyn Health's emergency medicine program. So thank you, Dr.
Thank you so much, Dr. Braha.
Thank
It's
you.
nice being here.
Thank you, and thank you for your interest in the show and your desire to become involved and more educated about healthcare. I invite you to join our website at zurmed.com and check out our tools and connect with us on social media. You can also reach us at 718-510-2103. I'm Dr. Braha, and stay healthy, Brooklyn. That was the video part of it. So, yes, that's good. So you're free to standalone, like Cobble Hill sort of thing.
Right, it'll be like
Yeah.
Cobble Hill, yeah. So I mean, it's really about rebranding emergency medicine and kind of, because these were 3 competing hospitals.
Yeah.
And so, I don't know if you've been a part of a merger